Most people find Medicare really confusing as they're trying to get started. So I created this easy start guide, focuses on the key parts without getting lost in all the minor details. I'm Medicare Mike. Let's get started. So if it doesn't yet, your mailbox is probably going to look like this soon. The amount of information can feel really overwhelming, and most people just don't know where to start. So I like to focus on just 5 questions that make this whole process so much easier. And at the end, there's a special bonus you can claim. I'll show you how to get it. So, what is it? When does Medicare start? What does it cost? What does it cover? What are your options? And how do you actually sign up? So, first off, when does it start? Medicare normally starts on the first day of your 65th birthday month. So, if your birthday is January 20th, your Medicare starts on January 1st. Unless, because there's an exception, your birthday is on the first of the month. Then it starts on the first day of the month before your birthday. So in that same example, if your birthday is January 1st, it would actually start December 1st. Now, are you receiving your Social Security benefits? If you've already started receiving those, you're going to get signed up for Medicare automatically. You're going to probably get a lot of mail, a lot of it's going to look official, but the one key thing that is going to come from Health and Human Services about 3.5 months before your birthday month, and that's going to be your Medicare card. Now, if you're not receiving Social Security benefits and you want to start Medicare on your birthday month, you're going to need to enroll. You do that through the Social Security office, usually online or over the phone. How much does Medicare cost? Well, original Medicare is made up of 2 parts, Part A and Part B. For most people, Part A is zero. You don't pay anything for it because you've already paid into the Medicare system. Part B, now the standard amount is what most people pay. That's going to be about $170 per month in 2022. But this can be higher, especially if your income was considered high by Medicare. Now they look back 2 years prior, and if it was above 91,000 as an individual or 182,000 as a couple, you could be subject to what's known as IRMA, which is an income related monthly adjustment amount where you would pay more than the $170 per month. So, what does Medicare actually cover? Well, like I said, the original Medicare is made up of those 2 parts. And it's not all that comprehensive. There's some major gaps that need to be filled. So, a few examples are Part A has this deductible of just over $1,500 if you're admitted to the hospital. So, you got to pay that before Medicare kicks in. And what's unique is it's really only good for a period. It's not good for a full calendar year, so you could end up paying that multiple times per year. Now, the Part B side, if you actually have to use your coverage, you've got a once per year deductible, which is nice, once per calendar year, $233. And then Medicare kicks in and will cover 80%, which would mean, unless you do something else, you're going to pay that other 20%. And what's kind of unique here is there's no cap, no limit to that 20%. However big the bill is, you've got 20%. In addition to that, something known as excess charges. So this is where doctors and hospitals can charge an extra 15% on top of what Medicare allows. Unless you do something else, you could end up being responsible for paying that extra 15% too. So, what are your options? I realize it feels like there's 100 different things out there, but really they fall into just 2 groups. It's either Medicare Advantage or Medicare Supplement. So I work with both good options, but I like to point out the major differences because everything in life has pros and cons. After that, most people are like, you know what? That sounds like me. This is what I want. Picking the insurance company then that offers the type of coverage that you want is a whole lot easier. So first major difference is network. Medicare Advantage plans, they contract with certain doctors and certain hospitals, and in general, unless it's an emergency, you need to stay within that network. Now, Medicare supplements, as long as that provider accepts Medicare, they have to accept all supplements. You're good to go wherever you want nationwide. Premium. So, monthly premium, Medicare Advantage plans are already getting paid by Medicare to provide you your Medicare benefits. So they charge you a whole lot less, a lot of times zero, usually less than $30 per month. Medicare supplements are going to be a higher, usually between $100 to $120 per month. But that's the premium. When you actually go to use it, now it's going to work a whole lot different because a Medicare Advantage plan, you pay more when you use it. This varies by plan, but in 2022, the maximum out of pocket can be as high as $7,550. So if you have to use the plan a lot, you could end up paying that amount before the insurance company kicks in and covers 100%. With a Medicare supplement, if you go with the most comprehensive option, you're going to pay $233 once per year. Medicare kicks in, the supplement kicks in, and you're done. You are no more copays. As far as kind of who's in charge of the care, well, with Medicare Advantage, like I said, Medicare, you get all your Medicare benefits from that insurance company and not Medicare. So they're in charge of your care as far as you might need to get a referral to go see a specialist, or you might need to get an authorization from them to cover something like a MRI before it's actually done. Where with a Medicare supplement, Medicare's in charge. Medicare handles all the billing. Medicare even bills the supplement company for you, so it's nice and easy. As far as the style of plan, so you might have heard about those all-in-one Medicare plans. Those are Medicare Advantage plans because they usually include your prescription drug coverage and a lot of times include extra things like dental, vision, or hearing. Now, Medicare supplement is going to be much more of an a la carte style setup because the supplement helps with your hospital medical. We would also do something separate for prescription drug coverage and things like that as far as dental or vision. So those are a lot of the key differences, but what happens if you change your mind? So if you start with Medicare Advantage and you decide down the road it's no longer the right fit for you, well, if you want to switch to a supplement, you only have a limited period of time when you're first starting Medicare that you're guaranteed to be approved for any plan. After that, switching from an Advantage to a supplement means you have to go through a health review. So the insurance company gets to ask you questions and then decide based on your health history if they want to accept you and charge you more, or say, no, we're not going to offer you coverage at all. Where with a Medicare supplement, if you choose that and you decide you want to go to an Advantage plan, easy, no questions asked, just say you want to enroll in it. So that's really the biggest question that my clients need to make as far as which route do you want to take, Medicare Advantage or Medicare Supplement. Everything else gets easier from here. And I realize that I say that now we got to choose a company and there's a whole lot to choose from. But once you pick the route, it makes it so much easier for me to pick the company and help you pick the company as far as which one's going to fit you, because there's no one best company for everyone. So if we're looking for a Medicare supplement, which is also referred to as Medigap, I can make this really easy. Here's a comparison I did for a client. And it's really important to understand, even Medicare says this, there can be big differences in the premiums that different insurance companies charge for exactly the same coverage. So it's going to cover the same bills, the same doctors in the exact same way, but some companies charge twice as much as the other one for the exact same thing. Now, if you feel like you're more of an Advantage client, there's going to be more moving parts here. And still something I can help you with and make it a lot easier to narrow down so we're not looking at so many plans. One of the first things I do there is look at which doctors, which hospitals are important to you, because each one's limited to a network. Then I look at how your prescriptions are covered and figure out how we're going to lower your costs there. And at that point, we start looking at other benefits like premium, maximum out of pocket, other benefits like dental and vision, because there's so many more moving pieces and these are not standardized. So what are your next steps? Well, you can click the button below, schedule a free consultation with me, go through and create a step-by-step Medicare roadmap for you so that you know what you have to do, when you have to do it, so Medicare gets started properly for you with no issues or penalties down the road. Also, I'll get you a personalized Medicare cost summary, so a report of the types of plans that you're interested in, specific company pricing, and how to enroll, so it's all nice and easy for you. So what do my services cost? Zero. You never pay me anything. You never pay extra for using me as your independent agent. The company you choose to enroll with pays me for helping you, but they don't charge you one penny more from using me as your independent agent. At this point, I might be new to you. You might be wondering, who am I? Well, I've been focused on Medicare insurance for more than 10 years. I started off working for an insurance company to understand how do they operate, how do I get things done in their world, but I speak plain English instead of that corporate double talk. So after that, I started my practice so I could be independent, work with more than 20 companies. That way, I'm not limited how I can help you because I work as an advocate, not only now as we get started, but also moving forward with any questions on claims, customer service, or reviewing your policy each year to make sure your coverage is still the right fit for you. So logically, scheduling that Medicare Made Easy meeting with me is the best step to take because the worst thing that'll happen is you take 15 minutes to learn something new that helps you make a better decision. As you can see from this slide, in my other reviews and different spots online, my current clients are really important to me. I'm here for you when you have any Medicare related questions moving forward. This isn't just an enroll and see you later. I'm here as your advocate to talk to companies for you. So, fifth question, how to sign up? Well, like I said, click that button below. Schedule that free consultation now. We'll figure out your step-by-step roadmap about what you need to do, when you need to do it, so you avoid any penalties and get great coverage that fits your budget. You're also going to get that free personalized Medicare summary with info about your costs and coverage so you can see in a very transparent way what your options are. And if it's a good fit, I can help you complete the enrollment so that it's easy for you, you know everything's completed properly, and you get all your ID cards well before you need them. Go ahead and schedule that call now. I'll talk to you soon.